Since 1983, FAME has helped business and education work for Maine. Contact the authority, the Finance Authority of Maine. You're watching Mainebiz Sunday, Maine's business news source.
We're back to talk about the new federal health insurance reform law and how it will impact Maine's businesses. To give us a brief rundown on the new federal law, we're joined by Charlie Dingman, a member of Preti Flaherty's Health Law Practice Group and a former general counsel for the Maine Healthcare Finance Commission. Dingman recently spent time in Washington, D.C. picking over this 900-page law, and he'll help us make sense of what to expect and what it means for Maine's businesses. Welcome, Charlie.
Thank you.
Great. So you're going to explain all this, right?
Well, I can't explain it all in the time we have.
Right. You know, it is huge, and I know that it was good that you were able to recently kind of go to D.C., and I know that there are a lot of folks who are really kind of trying to understand this and then go back to their states and make sure we all get the word. Okay, this is a major significant piece of legislation. In fact, I'm tired of hearing the word sweeping, everything, but it is. So give us the general overview in terms of what's the major significant bullet points about this.
Well, I think it's important to recognize that this is probably the most ambitious, farthest reaching, I won't use sweeping, piece of federal legislation in a half century. It's designed to solve a very complicated problem for the entire nation, but it's also designed to do it with a significant amount of variation and opportunity for innovation at the state level. It's aimed at two objectives. One is universal coverage, and the other is control of costs. And what I find interesting about it in particular is that it's a uniquely American-style approach. It's a hybrid of private sector and government action, much the way the United States has addressed almost every modern infrastructure problem, from railroads to telecommunication, and different from the other industrialized approaches in other parts of the world.
Well, they had a lot of models to look at, so that's true.
The key shift is from a health insurance system that now really competes on the basis of artfully dividing up the risk into segments and trying to adjust premiums accordingly, to a market in which there will be real competition on the basis of price and the quality of the benefit plans that are being offered. That's a very difficult shift to accomplish, and there are multiple moving parts in the bill designed to do that.
Right, and it'll take time, as you and I were talking before the show. It's going to take time to see how this all works, how successful it is at hitting that target. And one thing we wanted to talk about today in particular is how's this going to impact businesses, small businesses in particular, in Maine. So let's talk about some of those key elements. What should Maine employers know about this? What are the things that a person with 50 employees or more should know, and 25 or less should know, those kinds of things? Walk us through 3 or 4 of the key points.
Well, I think one key point is that it is applicable in terms of mandated delivery of coverage. It's applicable to businesses with more than 50 employees.
Okay.
Those large businesses are going to have to update their health plans to meet a series of key consumer reform requirements, and they're also going to have to monitor the way they change their plans going forward if they want to continue to keep the plans that they have in place pre-reform.
This is that grandfathered and non-grandfathered?
Yes.
Can you real quickly tell me what's a grandfathered versus a non-grandfathered?
What's going on here is an effort to allow plans that have been developed and are working prior to the Reform Act to continue in place, as long as they meet the basic consumer protection requirements in the law, and as long as they don't change substantially. So if deductibles and co-payments go way up, then it's no longer a grandfathered plan. If benefits get cut substantially, it's no longer a grandfathered plan. But if it stays about the way it was, and the definition of about the way it was is the subject of proposed rules that came out just this week and that everybody's studying.
Good. All right. More to do. All right. So talk to me about employers with 25 or fewer. What's going to be the real key for them?
The key for employers with less than 25 employees is that they are going to be looking at opportunities if they are looking to provide health insurance coverage.
They're not mandated.
They are not mandated.
Okay.
Under 50, you're not mandated.
Right.
Under 25, you get significant tax credit opportunities.
Okay.
If you've got average wages below $50,000, you can claim a credit. It's a sliding scale credit, depends on your average wages and your number of employees. It sort of slides down from 25 to 10. And after 2014, that credit goes up from 35% to 50%. So
Okay.
it's a very substantial credit.
Okay. Okay. Yeah, I want to move this forward because we're going to talk about more of this, but I
Yes.
want to talk about the mandates that are on this. I want to make sure we all understand what the real mandates are going to be for employers, and then because we can talk about more of that in the second segment. So walk us through that.
Well,
what are the key mandates?
There's one key and early one, and it's a simple reporting requirement, but employers are going to have to report on W-2 forms beginning in 2011.
All right.
Exactly what the value is of the health benefits that they provide to their employees. So that's going to be a number that's going to start to show up and have significance in various ways in health reform. The more significant mandate that I think everybody is really focused on is in 2014, again for the large employers only. If you have 50 employees or more and you have at least one employee who's eligible for a premium tax credit, then you will have to offer coverage.
Right.
And to have an employee who's eligible for a premium tax credit means basically you've got an employee whose income is below 400% of the federal poverty limit, and that you don't meet certain affordability criteria for the premium that employee is paying.
Okay. I'm going to move you on to one last thing
Sure.
because I know we're covering a lot real quickly, but I
Yeah.
also want to talk about, tell us about the penalties. And we kind of understand what's coming, what's going to be mandated, some of the key dates. What happens if I don't do it?
If you don't do it, and again, you're in this category of larger employers that's subject to the penalties, there's a $2,000 per employee penalty that excludes the first 30 employees.
Okay.
So it actually ratchets up gradually as you get larger. That penalty will also apply to an employer that does offer a plan if that employer's plan is such that there are still premium tax credit assistance being provided to their workers.
Okay.
I think it's important to recognize,
Yeah.
though, that the way this is built, the way the statute is put together, that penalty is really intended to provide an option to employers. This plan is intended to build on the existing employer-driven health benefit system that we have, but it's also intended to say, if you're an employer that doesn't see this as working for you economically, you have an option.
And that's what we're going to talk about is kind of, as we come back, we're going to bring in the other guests, and we do want to talk about what are those choices, what happens to, what kind of decisions will businesses, what are they likely to make, especially small business. So stick with us, we're going to bring some others on and talk about it. Okay. Stay with us, we'll be right back with a panel of experts, including Trish Riley, Director of the Governor's Office of Health and Policy and Finance, to discuss what this new federal law means for Maine business. Stay tuned.
Mainebiz Sunday is brought to you by Bangor Savings Bank, where you can enjoy free ATMs worldwide.